Hi everyone. Today we are going to discuss about dialyzer. First, introduction of dialyzer. Introduction. A dialyzer is an artificial kidney used in hemodialysis to remove waste products, excess fluid and toxins from the blood. When the kidney are unable to perform these functions adequately, it consists of a semi-permeable membrane that allow the exchange of solutes and water between blood and dialysate through the process of diffusion, osmosis and ultrafiltration. These are the main three principles of a dialysis process. Next we discuss about definition of dialyzer. A dialyzer is an artificial kidney used in hemodialysis to remove waste products, excess fluid and toxins from the blood through a semi-permeable membrane. It is called dialyzer. The dialyzer is a central component of hemodialysis system and it helps maintain the fluid and electrolyte acid base balance and in the patients with acute or chronic kidney failure. In modern dialyzers are usually made up of thousands of hollow fibers that provide a large surface area for efficient blood purification. It while ensuring the patient's safety and comfort. Next, the structure of dialyzer. We are discussing about the structure. Dialyzer consists of two parts. It has first one is blood compartment, then dialysate compartment. Blood compartment means the blood flow inside the hollow fibers and receive the blood from the patient through arterial line. Then the dialysate compartment dilysate flow outside the hollow fibers and it helps remove waste products and maintain electrolyte balance. Then the semi-permeable membrane and casing. These are the other two components of semi-permeable dialyzer. Then first one, semi-permeable membrane, it has separate blood and dialysate compartment. Then it allow the selective movements of solutes and water. In the casing of dialyzer, it is transparent plastic shell containing the fibers. The working principles of dialyzer. The dialysis machine mixes and monitors the dialysate. The dialysate is the fluid that helps remove the unwanted waste products from the blood. It also helps get your electrolytes and minerals to their proper level in your body. And then it cleans the blood and return to the body. The machines also monitor the flow of your blood and while it outside of your body. The dialyzer same as the kidney and it functions properly. Then it is also known as artificial kidney. Next is the dialyzer technical specification. First one is priming volume. It's vary from 40 to 150 ml. The priming volume means 14 ml to 150 ml of the purification process we are done in the hemodialysis machines. Then the priming is very important part of the hemodialysis and the dialyzer it remove all waste products and all waste contents and to remove the waste. The surface area vary from 0.5 to 2.2 meter square. Then the KUF from 2.5 to 85 milli per hour or mmHg. The KOA coefficient urea. This coefficient urea vary from 200 to 1200. It represent decrease the 300 low efficiency dialyzer and it higher efficiency dialyzer means it's above 600. Then the specification sheets also provide the clearance for urea and vitamin B12. The dialyzer are sterilized by gamma radiation and it ethylene oxide or by steam. It must be pre-rinsed to 2 liters rinsing solution above. This prior to connecting the patients to prevent release of fragments then from the dialysis circuit. Next, the dialyzer types. There are 3 dialyzer types. First one coil dialyzer, then permanent dialyzers, and most commonly we used the hollow fiber dialyzer. First we discuss about what is coil dialyzer. Coil dialyzer means it's flattened cellulose tubing and wrapped as a coil, and it through which the patient blood flow during the dialysis. The coil dialyzers, the blood channels was long to obtain the needed surface, and its area and resistance was so high. Then the ultrafiltration of coil dialysis was unpredictable, and the many chances of blood leak were frequent. Next, we are discuss parallel plate dialyzer. The parallel plate dialyzer is a sheets of membrane are placed between supporting plates. Then the plates have rigid and grooves to support the membrane. It allows the flow of dialysate along it. Its resistance to blood flow is low. The surface area vary from 0.25 to 1.5 milli square. The advantages of parallel plate dialyzers, the blood volume is about 50 to 100 ml at 100 mm Hg, which increases with the HL or TMT. Then the heparin requirement usually low. The minimal clotting in the blood compartment and the ultrafiltration is reasonably predictable and controllable. The disadvantages of parallel plate dialyzer. It is the formation of local thrombi around the inlet and outlet ports of the dialyzer and corners. It may lead to the bacterial growth and endotoxins formation. Therefore, the plates are not often reused. Next, we are discussing what is hollow fiber dialyzer. This is now we are using. First one, the hollow fiber dialyzer is a numerous hollow fiber, and it has a tiny, its diameter 150 to 250 mm. The number of fibers is 20,000 or more depending upon the length. The kind of membrane and the surface area of the dialyzer, it's vary. Then the advantages of hollow fiber dialyzer. It has low blood volume 60 to 90 ml, and the resistance of the blood flow is low. The ultrafiltration can precisely controlled. It all adapted to reuse. The disadvantages of hollow fiber dialyzer. It is the fibers of pre-dialysis necessary to prevent the airlock of the fibers, and it more heparin is required for the most of the patient. The adverse patient's reactions. These are the features including the hollow fiber dialyzer. Next, what is dialyzer? The dialyzer is an ideal should have high clearance of small and medium toxins, adequate ultrafiltration, and it has negligible losses of proteins and amino acids. It has toxic composition. The minimal activation of cells or thrombotic pathway. It has minimal blood volume and reusability and low cost and reliability. Then the advantages and disadvantages of high flux dialyzer. The high flux dialyzers, it means the better toxins removal, and it improves the fluid management, then reduce the dialysis related complication, and it enhanced the patient outcome. The disadvantages of dialyzers, it has clotting of blood inside the dialyzer if anticoagulation is inadequate. Next, The loss of blood due to leakage or rupture of the dialyzer's fibers, and it has allergic reactions to the dialyzer membrane or sterilizing agent. The infection risk of the dialyzer is contaminated or improperly handled. The incomplete toxins of removal in the dialyzer efficiency is very low. Next one, the protein loss may occur with the high flux dialyzers. The cost of the dialyzers can increase the overall expense treatment. Then the membrane incompatibility may cause the inflammation or activation of the immune system. The need of regular replacement as dialyzers cannot be used indefinitely. The environment waste due to disposal of used dialyzers, and it has associated materials. Next, the dialyzers. Thank you. And the factors affecting dialyzer performance, its membrane surface area and blood flow rate, it means QB, and the dialysate flow rate, it means QD. Then membrane permeability. The other factors include duration of dialysis, then the dialyzer reuse practice. The last complication of related dialyzer reuse, it has allergic reactions may occur if the dialyzer is not properly washed. Then the clotting of the dialyzer fibers, then hemolysis, mainly a complication. Next, hair embolism and the blood leak and clotting. Then the hypersensitivity reactions. These are the main complications occurred in the dialyzer. The conclusions of dialyzer. The dialyzer is the core components of hemodialysis. Its functioning, it is an artificial kidney and its efficiency depends on the membrane, then characteristics, then surface area, blood flow and dialysate flow. These are the factors including in the dialyzers during hemodialysis. In the modern high flux dialyzers, they provide effective clearance of toxins and excess fluid, and it improving the quality of dialysis treatment and patient outcomes. The core compartments of the hemodialysis functioning as the efficiency depends on the membrane. So, it improving the quality and dialysis treatment patient outcome. We can choose the dialyzer for as an artificial kidney. So, we are known as dialyzer is a core components of hemodialysis. Thank you.